All right. Good morning, everybody. I am Michael Chesney. I'm a Senior Communications Manager here at ChristianaCare, and I am joined this morning by Dr. Marci Drees, who is ChristianaCare's expert in all things COVID and a whole bunch of other things, infectious disease related, but we're, of course, going to be focused on COVID today. First off, Dr. Drees, thank you so much for joining me today.
Thank you, Michael, for inviting me, and welcome to everyone who's joining.
Well, let's jump right in. We've actually gotten some great questions in through the chat. So if you are watching and you want to ask a question directly to Dr. Drees, just put it into the chat and I'll get that, and we'll try and get as many of those questions answered as possible. But in the meantime, let's just start broadly. Where are things with Omicron right now? Are we peaking? Are we plateauing? And if that's the case, what's the difference between those two things? Kind of what are we looking at right now?
Well, a peak is obviously the highest point that you reach in terms of new infections or hospitalizations or whatever it is that you're looking at. We often don't know exactly when the peak was until later, when we saw that we came down from that peak. A plateau would be if we reach a high peak and then we stay there for a while. Where we're at now, I think, we in Delaware, our cases are still on the upswing. Comparing last week to this week, the rate of increase has started to slow down. So hopefully that means that we are starting to peak. But again, we won't really know for sure until probably another week or two to follow the data. When you look at the country as a whole, the whole country is red in terms of, high rates of community transmission, but not all states are in the same place. There's some evidence that the Northeast, Massachusetts, New York, et cetera, has already started to peak and come down. The Midwest is probably still on the upswing. So, I think we're getting close, we hope, to where we should be starting to see a decrease. And we've already started to see a slight decrease in hospitalization, so that's reassuring. But again, we won't really know for sure after another week or two as we follow the data.
What causes a peak? What causes that, the numbers to finally start to decline? How's that happen?
Well, I think, the virus is really just looking for the next person to infect, right? So either it's gone through as many susceptible people as it can reach, and the people that are left are either, they're protected through vaccination or recent infections. But also I think people change their behavior, right? We've seen kind of the rapid increase in cases, and people, mask mandate, at least in Delaware, has gone back into effect. People I think many people are being more careful than they were maybe 2 or 3 weeks ago, and that all changes the virus's behavior as well.
Got it. Where are we sitting right now, at least in Delaware? And I think that Delaware can be a pretty decent proxy for the surrounding counties that ChristianaCare is also responsible for. Where are we sitting right now in terms of the positivity rate? And is it an accurate reflection of really what's going on out in the world, vis-a-vis?
Well, yeah. So the positivity rate is extremely high. It's about 30%. It was a little bit over 30%. This past week, it's a little bit under 30%. So hopefully we're starting to see that come down as well. Is it 100% accurate? No, because we now have all these home tests, right? So a lot of people are getting tested using home tests. Those negative tests are not getting reported anywhere. If you have a positive home test, you're still supposed to notify public health that you had a positive test. I'm sure many people aren't doing that, however. Yeah. So, it's not 100% accurate just because we don't have all the data, but I think it certainly is a reflection of really, really high transmission. You want your positivity rate to be less than 5% if you think an outbreak or an epidemic is under control.
And so we are just way.
So this is really as high, from the very beginning, we had a very high positivity rate because we were really restricted on who we were testing because we had limited testing. But since then, this is the highest positivity rate that we've seen. And it just, again, reflects, how transmissible the Omicron variant is.
Can you talk a little bit more about hospitalizations and what we're seeing from that perspective? And there's some discussion out there that maybe hospitalizations aren't necessarily tracking case, increase. And that being said, then why are we seeing such, I hear ChristianaCare, we're under crisis standards of care. Can you explain kind of what's going on there?
So, I mean, the good news is, even though we've seen, extremely high increases in new cases, our hospitalizations, while they are increased, they are not increased at the same rate. So I would say, though, we still are seeing more people with COVID in the hospital than we had even last winter at the top of our surge last winter. Um, and so I think there's this misunderstanding out there that Omicron is mild. And I think, when you look at overall the population level, yes, it may be, 20, 30% milder in terms of less likely to cause severe disease. But when the number of cases is increased, tenfold, you still see a lot of individuals that get really sick from COVID. We have people in all of our ICUs with COVID, many non-ICU patients with COVID. And as an individual level, you don't know if you're going to be the one that gets that mild case or one that gets a more severe case. And it's not necessarily tracking only with age or other underlying conditions.
Is Delta still out there? Is it still part
Delta,
of the
I mean,
conversation right
Delta,
now?
not really. If you look at the CDC, the strain, obviously not every strain gets typed, but the sampling that they type, it's 99.5% Omicron now.
Wow. Wow.
Yeah, and you look again, it's a little bit variable across the country. The Midwest again lagged a little bit behind, but they're still above 95% Omicron.
Oh, and that happened very quickly.
Yes, it happened within a space of a few weeks, actually. Like, it was pretty incredible, actually.
We've question coming in from Patricia. What are the main symptoms showing up right now, and especially signs and symptoms of Omicron, maybe comparatively to Delta or Alpha or anything else? Because there certainly has been a shift in kind of what this looks like.
Yes, thank you, Patricia, for the question. I think, it can always be very variable on the individual level, but I think we are certainly seeing, more people presenting with, just upper respiratory cold-like symptoms, sore throats, nasal congestion. So really at this point in time, if you have any sort of cold symptom, you have to assume it's COVID until you are tested and prove otherwise. But that said, we don't see as much fever. We don't see as much of loss of taste and smell like we did in the beginning. But certainly, individuals are still presenting with that, and people are getting really sick, having difficulty breathing, getting COVID pneumonia, and many of the other complications as well. That part hasn't changed.
Talk a little bit about a sense that maybe the virus is living sort of in a different part of the body, and that might be part of kind of how this is more transmissible. Can you talk a little bit about that? Because you kind of dovetailed into it a bit.
Yeah, there's some evidence that this variant of COVID lives or survives a little bit better in the upper respiratory system. So, your nose, your nasal passages, oral cavity is cooler than, say, your lungs. And this virus may just have been adapted to live there a little bit better. So what we see is really high viral loads in the upper respiratory system, which makes it really easy to transmit to others, but a little bit less in the lungs where it causes pneumonia. That said, obviously, it still can cause pneumonia. It's just a little bit less likely to do
that. If I've already had some other version of COVID, if I'm that person who got it in this summer of 2020, do I need to be worried about Omicron? Can I still get that?
So absolutely. So I think what we've seen with this variant is what they call immune escape. So when you have antibodies either from a prior infection or even from 2 doses of vaccination, this virus, you're still able to be infected with this virus. So particularly if you had COVID a long time ago, you are absolutely susceptible to getting Omicron now. If you have an Omicron, if you recently had an Omicron infection, within the last month or so, you are probably protected for some period of time. Similar, we've said, up to 3 months, you're unlikely to get reinfected. I haven't seen any new data that suggests that Omicron will be any different. But certainly if you had what was probably Delta or a different variant before, you are certainly susceptible to get Omicron now.
You mentioned this sense that Omicron is milder, and there is, I think, a lot of baggage getting attached to that word, and leading to maybe this idea that not so much a thing anymore since the chickenpox vaccine exists now, but back, when I was a little kid, and certainly before that, this like chickenpox parties, or like just give it to them and get it over with was sort of a thing. Talk to me about that sense out in the world right now when it comes to Omicron and COVID.
Yeah, I mean, chickenpox parties were a thing before we had an effective chickenpox vaccine, right? We don't want to start having Omicron parties, just because, again, as on a population level, it may be milder overall, but for any given individual, you don't know if you're going to be the one that gets that severe case, or if you're going to be the one that has an asymptomatic or mild case, but then goes on to develop long COVID symptoms, that have persistent symptoms for weeks or months. So, we still want to be doing everything we can possibly do to prevent ourselves from getting Omicron. And that's, getting fully vaccinated, getting boosted, using our masks, and just being smart around, not exposing ourselves unnecessarily to this virus.
We're getting a lot of questions here about the vaccine specifically. So let's talk a little bit about that. This question from Lorraine: how well are the booster shots holding up to the new COVID variant, and how long after getting the booster is it in full effect?
So what we found was that 2 doses of the Pfizer or Moderna vaccine really did not have a lot of protection against Omicron. But when you get that booster dose, that third dose, it does increase your protection back up to close to where it was, where 2 doses would have held you for Delta or any of the prior variants. So it's still, even 2 doses appears to be pretty well protective against severe disease and hospitalization. But for more protection against any infection, you want to get that third booster dose. And that dose will start to protect you almost right away. Like I've seen increases in antibody levels like really within a few days. So I haven't seen, they haven't said that, you need 14 days to be considered fully boosted. It's really, get boosted and that protection will start to increase almost right away.
You talked a little bit, maybe directly to people who are seeing what's going on with the vaccinations and kind of have watched the conversation change over the course of time from, this is going to protect you from getting it, and we're going to get to herd immunity. And then it started to shift a little bit to this is about, stay in severe disease and staying out of the hospital. And now you're on your first booster and we're going to get a second booster. And I think a lot of people are looking at it and going, they're just kind of throwing their hands up a little bit. Can you talk directly to those people, maybe help to assuage their concerns a bit?
Well, I mean, I think it's not uncommon for, many of our vaccines that we give in childhood are multiple doses to really get that full protection. And so we've obviously been learning as we go along and as these new variants emerge, and we want to be able to pivot and make sure that people are as well protected as possible. So like I said, we learned that 2 doses probably wasn't sufficient for Omicron, and now we're doing the booster. And we also know that at least 2 doses, your protection wanes over time. So I think it remains to be seen what will happen with 3 doses. Certainly, we expect antibody levels to wane over time. That's what they do. They don't stay at a high level forever. But we also hopefully are generating that good, memory cell, B cell, T cell memory immunity that will kick in, months or years later. So I think, I don't think we're certainly out of the woods in terms of needing yet another booster. Obviously nothing's been decided about that yet. If we can get to the point where COVID is an endemic disease where we see a little bit of a bump in the wintertime, it may be, we have other human coronaviruses that really just cause common colds, and they circulate, in the wintertime typically. I don't know if we're going to get there with this coronavirus, but certainly that is the goal, that over time it will become milder. We'll all have some measure of immunity because of our vaccines or because of exposure, and it won't be the kind of society stopping pandemic that it is now.
You talk a little bit about the where we are on masks and what people should know and what they should be doing right now.
Yeah, masking has obviously been another, it's been changing guidance, and some of it has been learning more about how this disease was transmitted. I think if there was one thing I wish we had known from the very beginning was the rate of asymptomatic transmission of this virus. SARS back in 2001 didn't do that. And so we weren't really thinking about that, at the very beginning. But I think now the data is extremely clear that masks work. A mask is better than no mask. CDC recently updated their guidance to suggest, higher level masks, things like N95s, KN95s. But I don't think there's not a huge amount of data that says you have to do that. It's just something to consider. Our supply chain issues are better now than they were. And N95s are easier to find in the community, although you have to be careful because there's a lot of counterfeit ones out there as well. But the most important mask that you can wear is the one that you will wear and wear consistently. So you can have like the highest level, fanciest mask in the whole world, but if it's uncomfortable, if you're claustrophobic, and you're going to have to take it off frequently to breathe better, then it's not a very effective mask for you. So there again, CDC has a number of different strategies around making sure that whatever mask you're using fits well. If you are using a cloth mask, make sure it has multiple layers. You shouldn't be able to see the sun through it. You can actually double up and use a surgical mask underneath a cloth mask to make sure that it fits really well. But basically, you just want to make sure something that you'll wear, that you can breathe through, that covers your nose and mouth, doesn't have any gaps along the side, and to wear it consistently. That's the most important thing.
Gives us a couple more minutes here. So tell me about the current treatment options out there for people. And if I have COVID, if I'm not vaccinated and I get COVID, well, I'll just take a therapeutic or something like that. Does that strategy work? I mean, so where are we?
Well, so there's a few different treatments. So the one IV medication called remdesivir has been around for a long time. We typically use that for hospitalized patients who are sick enough to be in the hospital. But we have two new oral antiviral pills that have just been approved for emergency use within the last month. Supply of both is extremely limited. So we have strategies in terms of making sure that the highest risk patients get those treatments, and they're really designed to keep you out of the hospital. To mitigate your symptoms. And then we have monoclonal antibodies. So that's an antibody that helps kind of boost your immune response to help you control the virus sooner than your own immune system can do on its own. So we've had those for a while too. We had to pivot because Omicron was resistant to the ones we were using. And now there's only one of all the, half a dozen or so that are out there that works against Omicron. So again, very short supply of all these treatments. They're great tools to have in the toolbox. But you really can't rely on having access to those, in the moment that you're sick. They all have to be given within a certain time frame of testing positive. You have to be symptomatic, and you have to have some other high risk condition in order to get them. So prevention is always better than treatment if we can do that. So I wouldn't rely on treatments instead of getting vaccinated and boosted.
So get vaccinated.
Yeah, exactly.
Get vaccinated. Got it. If you aren't vaccinated, you can track COVID. This is another question coming in from the chat. How soon after a negative COVID test can you get vaccinated?
So if you happen to get COVID, you don't have to have a negative test to be vaccinated. You really just want to wait until you're no longer needing to be in isolation. And that for most people is, we say 10 days, ideally, so that you're not going to a vaccination clinic and potentially exposing others to COVID. So 10 days after either your onset of symptoms or your positive test, you can go ahead and start your vaccination series or get boosted if you're due for booster.
Do you test positive for the virus after you get vaccinated?
You don't. So the type of tests we do for diagnosis are they're looking for actual viral particles, and that's the vaccine gives you antibodies. So there are certain antibody tests that we can use that might be confused whether you're infected or vaccinated, but we don't use those for diagnosis. So if you do develop symptoms, we know some people can have some mild symptoms right after getting vaccinated, but they tend to be mild, last a day or two. But if you have something more significant or longer lasting, you can go ahead and get tested for COVID because you could have been exposed around the same time. And that won't your vaccine won't interfere with those results.
Last question to wrap up here. Flurona. It's got a catchy name.
Yeah.
Is it something that people really need to be worried about?
So flurona is not a thing in and of itself. It's not like flu actually combined with coronavirus to create some new superbug or anything. All that really refers to is people getting both influenza virus and coronavirus at the same time. And we know, last year we saw almost no flu. We're seeing more flu this year. So both viruses are circulating. Obviously, COVID is circulating at a much higher rate than flu is. And there have been cases reported of people getting both at the same time. Some reports have said those people are a lot sicker. Some have not found that. So clearly, the things that we do to prevent COVID will also prevent flu. Masking, obviously getting vaccinated against both flu and COVID are all really important. So you don't want to get either one, and certainly you don't want to get them at the same time.
Got it. I feel like in this moment, I'm going to be the personal trainer who says, this is your last one, and then tells you to do 5 more right after that. We just got a question from the chat, so I'm going to try and end on this one. What do we know now about when a person is contagious for the onset of symptoms? And, and how maybe, to add to that, how maybe do we adjust how we react based on that?
So we know that with flu, and really with COVID all the way along, people are contagious for a day or two before they develop symptoms. And that's one thing that makes it really hard to prevent transmission is if the person that you're meeting with today develops symptoms tomorrow, you have no idea that that's going to happen in the moment. So we just have to be careful all the time. So that part hasn't changed. We know that people can still transmit before they get symptoms, and even if they never get symptoms, they can still transmit to others. What's a little bit different with Omicron is that the incubation period, the time from when you're exposed to when you first develop symptoms, is shorter. So it used to be 5-6 days. Now it appears to be mostly 2 to 3 days, which again makes it really hard to, get tested, contact trace, protect yourself, because it's just such a short turnaround time before you've already had the chance to spread it to others. But really, it's in that kind of first 5 days where for most people your viral loads will be highest, and that's when you're most contagious. And again, CDC changed its recommendations that you could come out of isolation after 5 days and just wear a mask for another 5 days. And that will prevent most of the transmission, but certainly people will continue to be contagious beyond 5 days and should continue to be really, really careful. And if you don't have to go out, don't go out. Wait the full 10 days and just be careful. If you're immune compromised, it can be even longer that you can shed virus. So just be as careful as you can be.
Great advice to wrap things up. Dr. Drees, thank you so much. And thank you to everybody who joined us either live on YouTube or in any of the platforms. So this will be available in just a little bit. Again, stay safe, stay masked, get vaccinated, all of those things.
Get boosted.
Get boosted. We want you healthy and happy, and